Welcome to the Libido Lounge, where we focus on all things love, lust, and libido. We believe that fabulous sex is important to health as exercise and good food. Hey, everybody. Welcome back to another episode of The Lounge. I'm your libido host and expert, Dr. Diane. And today we have a special treat. My friend, Dr. Doni Wilson, who is another naturopathic doctor, is an amazing expert on stress, on HPV, and all of the different subsequent things that go with these conditions. So we're going to get into some juicy stuff today. We're going to talk about HPV, what to be aware of, how this affects your libido. We're going to talk about stress and how to manage that, and so much more. So welcome. Thank you so much for being with me today.
Thank you for having me, Diane.
Well, it's a pleasure, and we're just going to jump right in here. So I want to start our conversation by talking about HPV. And I want to start because from a libido standpoint, I know we're going to talk about this a lot today in our time together, is there's so much impact with something like HPV around shame, around guilt, around, am I safe for myself? Am I safe for my partner? So how do you and you work with so much HPV in your practice, and I think you've done a really amazing job at just not only bringing awareness to this topic, but also helping people work with all of the emotions that come up with that. So can you just walk us through, because this is so connected to our sexual health, our personal health. When somebody gets an initial HPV diagnosis, what is the first thing you tell them? Where do they start? What do they need to be thinking about?
Oh, so I'm so glad you're asking. And yeah, exactly. For anyone listening, when you go in for your pap smear, now more and more it's becoming the standard for practitioners to also test for HPV. That was not always the case in the past, right? We used to only test for HPV if there were abnormal cells. But now HPV is being tested right with the pap smear before we even know if there's abnormal cells. And so more and more women are finding out that they're testing positive. Also, I think that because we were under so much stress during the pandemic, and there's now studies showing that COVID increases the risk of HPV, and a lot of women were delayed their pap smear because of the pandemic. So I think all of that combined is why we're seeing so many more women who are coming back testing positive for HPV. And so that's exactly, they reach out to me from around the world. I hear from women, because this is the case around the world, is that women are finding out they test positive. And the thing is that there's some studies, these are older studies, like particularly a study from 10 years ago that said that in 90% of cases, the human body will clear HPV, meaning it'll go to negative within 2 years of being diagnosed. And because practitioners know about that study, they will often tell women, okay, you tested positive for HPV, there were no abnormal cells, so it's quite likely it might just go away. How about you come back in a year and we'll recheck it? And so a lot of women are being told that, and they're essentially in this wait and see, right? Well, you're just going to wait and see if it's going to go away. If you're going to be in this, essentially the 90% that it goes away in 2 years. The thing I'm also seeing, Diane, is that more and more women are saying, I'm not okay with wait and see. I'm not okay with find out, because these HPV viruses that we're talking about are high-risk viruses associated with cancer risk. Right? So it's associated with cervical cancer, vaginal cancer, also anal cancer, oral cancer, and in men, it's associated with also penile cancer. So a lot of women are unsettled with that. They're like, wait a minute, I can't sleep at night. I don't feel comfortable going into intimate relationship. I don't know what I'm supposed to do with my life because I don't know if this virus is going to cause cancer or not. And so if anyone listening is like, yeah, that sounds like me, I'm not okay with wait and see. And so I think we're seeing a shift that's happening on the side of that women are saying, hey, I don't want to just go by what my gynecological practitioner is telling me to do. And the fact is that in gynecology, the only thing they really can do is remove abnormal cells, right? So if abnormal cells develop, if it's mildly abnormal, right? So if it's inflammation or CIN1, again, your doctor can't do anything. They're just going to still say wait and see. If it goes to CIN2 or CIN3, more severe abnormal cells, they can do a procedure to remove those abnormal cells. Let's say a LEEP procedure or conization. But the important thing to know is that the procedure to remove abnormal cells doesn't kill the virus. And getting a vaccine again doesn't kill the virus. So what tends to happen is women will have one LEEP, and then 6 months later they go back and recheck, and then the virus causes abnormal cells again. And they go into this never-ending cycle of pap smears and colposcopies and LEEPs and potentially hysterectomy, and the virus never does leave them alone. And no, this is not 100% of the case, so I don't want to scare everybody, but there's that potential there. And so I think more and more women are taking their own health into their own hands and saying, I don't want that to happen to me. I want to do something now instead of waiting to see if abnormal cells develop. And so that's the questions women ask me. They say, what can I do now? What can I do to get this to go away? I want to be proactive, and my practitioner is not giving me any idea of what I can do or how I can speed up my body's ability to clear this virus.
Yeah. I think there's so many layers with this, right? I feel like there's a layer of, oh my gosh, this happened. Like we have this personal relationship to our anatomy, especially the anatomy that kind of defines our femininity, our masculinity, and, breasts, anything that happens with our vulva. I think just like it impacts us as humans in a way that is beyond, say, breaking a toe, right? So there's so many layers and so much confusion that happens here. So what do you, from a testing perspective, because of this, what you're bringing light to around pap smear doesn't do everything, and we haven't been testing this. Do you recommend, from say just like a prevention standpoint, that every time people go in for their well woman, they get tested? And can you talk a little bit about men and why we haven't been testing men and that component of things? Because I think there's a huge problem, right, with that emphasis on women getting tested. And then, like you said, we can have penile cancer. And I think men are just oftentimes left in the dark with this.
Yeah, absolutely. I do recommend finding out if you're testing positive for HPV because of helping women and men for over 24 years. What I find is that I'm able to help them clear the virus and have it not come back again. So I would rather know if you have the virus so that we know you need my protocol. So then you have a clear action step, like, okay, it's positive. Let me go into action and make these diet changes, figure out why I'm susceptible. Because really when it comes to HPV, and we can talk about more of this, is that it's about why is it coming up positive now? Because we're most all exposed to this virus. The studies show that by age 50, we are most all exposed to this virus. It is not a rare thing. Men and women are exposed to this virus. So if that's the case, then we should be able to clear it if we address the root causes of why it's there in the first place. So I would rather know it's there and start taking action and help you clear it and protect yourself from it in the future. And in terms of men, the thing is in the United States, there's not a standard screening test for men for HPV. Now there is for women, and I'm actually grateful that as women, we can find out early. Like we actually get to, thank goodness, we get to find out before it causes cancer, hopefully, that it's present and potentially causing abnormal cells. And then with the work that I do, we can prevent it from hopefully causing cancer or prevent it from causing cancer again. And for men, they don't have that opportunity. For men, HPV can cause cancer, and they only find out they had HPV once they got cancer. Now, that's not the case in other countries, by the way. There's countries in the world where they do screen men for HPV. And I believe that in the near future, that will become available in the United States. But it's interesting because, as you're mentioning, it's going to open up this big conversation of how do we talk about our intimate partners, talk about this with our intimate partners? Because this is, a lot of times what women will say to me is if they mention it, say to someone they're dating, that other person may not have that information or knowledge about it. And so they might freak out and leave the relationship. And there's actually studies that show that testing positive for HPV does have a very significant psychosexual impact on women's lives. Meaning, you first of all, it could be in your own mind where you test positive and then you're afraid to have sex and you're afraid, is this going to impact your fertility, for example? Because when you have multiple procedures on the cervix, it can increase risk of miscarriage, and so it can impact women's fertility. And it can also impact if they do choose to say something about it with their partner and their partner's not informed. That can create a lot of tension. And it can also, by the way, it can bring up, I think, very unfortunately, it has led to a lot of conversations with couples where they're saying, hey, how did you get this virus? And so there's accusations of, did this person have sex with in another relationship? And that's how they got exposed to HPV. And I want to just right away say, we cannot know that, because the HPV virus, each person could have been exposed years ago, and it maybe wasn't testing positive until now. Also, it's you can't tell based on an HPV test that shows positive. It doesn't tell you from whom you got it or when. So it's simply information that we cannot have. And so I as much as, sometimes we get into this drama of how did I get this? Who did I get it from? Was my partner, not being loyal to me or honest with me? Those questions have to be, I think, separate from the conversation with HPV, because we can't tell that based on simply having a positive HPV test.
Yeah, I think it's really important because obviously that comes up a lot. And especially like not testing males, it's super possible that a female gets HPV and is actually from her current partner that didn't have any symptoms and is not being tested. And, or like you said, it could also be from somebody a long time ago. So I like that idea a lot of just like, these are separate conversations that never should be intertwined, because there's literally could be absolutely zero relationship. Of course, there could be a relationship, but there's no way to know. Yeah. So let's talk a little bit about the why, because you brought that up. And I think that's a really important thing to make sure we get covered today. So somebody, like we've said, this could be dormant for years. This could be going on for years. So then why all of a sudden is somebody going to manifest symptoms or test positive? And what's going on to really prevent the body from eliminating or preventing that virus from setting in?
What I find, and Diane, this is from working with thousands of patients over a couple decades, and I'm always asking them, as naturopathic doctors, we're always asking, like, what's happening in your whole environment? What's the root cause of this? What's happening? And one of the most common questions I ask is, has there been a significant amount of stress in your life in the past 2 to 5 years? And women consistently report that yes, they have been under significant stress, whether that was relationship stress, let's say from either an abusive relationship or a divorce or separation. It's also often reported that they have had a death in their family, or more than one death in the family, someone close to them who passed away, or even a pet who passed away. Also, if they've had significant job-related stress, or maybe they're a graduate student and they've been under a lot of stress because of that, or they recently moved from one area of the country to another area of the country. And as I mentioned before, maybe they had a significant illness, either significant COVID or other illness or injury or car accident. So these are the types of things when we start looking back and say, why now? We end up finding, oh, okay, their system went through a significant stress. And what we know is that when humans go through significant stress or even chronic stress over a long time, is that it disrupts our stress hormone levels. Our cortisol levels can go too high or too low. And when cortisol is too high or too low, that disrupts our immune system. So now we're more susceptible to infection. So that's one of the connections with stress, is simply cortisol in the immune system. But we also know that stress disrupts our digestion. It causes leaky gut. It causes an imbalanced microbiome. And now we're seeing studies connecting imbalanced microbiome in the gut to imbalanced microbiome in the vagina. And when that happens, we become more susceptible to HPV. Also, we know it can have to do with toxin exposure, which is really another stress. So I see a lot of women who've had mold exposure, for example, and then they become HPV positive. So we have to help their body to detoxify. So I'm always looking for what was it that was a stress. In some cases, Diane, it's all of those things, right? Sometimes women are having hormonal changes and emotional stress and an infection of some type and a toxin stress, and then it all just crumbles from there. And of course, HPV just takes advantage of that. It's really a type of virus that takes advantage when we're worn down and depleted.
Yeah, thank you for all of that. And you bring up so many like vicious cycles, right? I feel like I talk about vicious cycles a lot in my work around microbiome of the gut, microbiome of the vagina, and HPV there, and stress and how it relates to all of it. And I think we should kind of wrap up our episode before we tell people where to find you with actually breaking down one of my like most common vicious cycles that I talk about, which is really the stress libido vicious cycle from a standpoint of we get stressed, we don't want to have sex, and then we don't release oxytocin, and that's our master stress hormone. So I talk about that all the time on this podcast. So I'm wondering if you, especially with you being also, in addition to an expert in HPV, also an expert in stress and stress resiliency, and you have your book, Master Your Stress, Reset Your Health. So can you break down, besides my favorite way of working with stress, which is working on the libido, what other ways do people get out of this vicious cycle to set their microbiome, to set themselves up for a better capacity to just be healthy and to recover from things like HPV?
I love that you're mentioning oxytocin as an anti-stress hormone, so that's exactly it, is we need to, because it's not about trying to eliminate all the stress. Yes, we can do our best to reduce our stress and avoid stress when we can, but we're going to have stress as humans. So it's more about how do we recover from it, and then how do we master it? That's why the name of the book is like that, is because it's how do we continue to support ourselves. And so, yes, choosing those anti-stress activities, also looking at diet. We look at what are the dietary exposures that reduce our immune system, like sugar, alcohol can reduce our immune function, as well as food sensitivities that are inflammatory. So we look at that, and then we look at I look at those adrenal hormones, cortisol and adrenaline. How do we optimize them? How do we look at all your nutrient levels? Are you deficient in iron or B vitamins? Let's address what got depleted by stress. And in doing so, including rebalancing hormones, rebalancing microbiome through, diet changes, adequate sleep, right? And these recovery activities like sex is one of them as well that I list in my book I call it a recovery activity, something that gives us these anti-stress hormones. It could also be spending time in nature, connecting with a friend, just by even talking or a hug or pets. All of these things are activities, meditation, music, that help us to counteract and recover from stress and then become resilient to stress ongoing. Also, of course, movement and exercise. So I walk women through, let's figure out what it is for you as an individual that got affected by stress, including from potentially toxic or abusive relationships. Let's recover from that. And then let's help you really learn what your body needs ongoing to stay healthy, even if you get exposed. See, this is the thing I always like to clarify is, women are afraid to have sex again because they're like, I don't want to get exposed again, even if you're married. And I really teach them that based on my patients, that's not the case. I work with women who are still in the same relationship with the same person. So that person, there's likely still HPV around. But now, based on really learning how to take care of themselves, they can keep fending off that HPV. They can be resilient to it, even if they're exposed to it again. And I really think that's what we're aiming for. We should not have to shut down our sex life based on fear of HPV or risk of HPV. We should be able to feel empowered about protecting ourselves and still be able to be intimate as much as we choose in our lives.
Yeah, I really love the belief like a healthy body is a resilient body. And that's exactly what you're talking about, right? When our body is truly healthy and when we're in balance, we are more resilient to toxins, to infections, to stress, and all of these things. And we are running out of time. I want to remind everybody that's listening that we are going to invite our top podcasts, the ones that have the most downloads. We are inviting these speakers, the top 4 people, back at the end of the year for much longer deep dives. So please do download this, share this with your friends. If you want Dr. Doni to come back, which I certainly do, please make sure you download this and share this around. I know we're going to have a link to your book in the show notes. And then I also want to make sure everybody knows about some of your workshops and some of the other cool things that you do. Can you just tell us about them? And we'll put that in the show notes as well.
Absolutely. So if you're resonating with this and you want to learn more what you can do to address HPV once and for all and just now be resilient to it so you can move forward in your life, then I encourage you to join me for the Heal HPV workshop. We offer this workshop on a regular basis, and it's a live workshop where I really teach you all the details of what I've just been mentioning here about how you can take steps to get HPV to negative. So yeah, we can put the link for the Heal HPV workshop. I also have an HPV recovery guide, and I'm happy to share a link for that as well. Those are both free ways for you to learn more about how you can gain freedom from HPV.
Thank you. Thank you so much for being here with us and for all of this information. I really appreciate you, Doni.
Thank you so much. I'm really glad to be here.
And thank you, everybody, for listening. This is another episode on The Lounge. Dr. Diane signing off here, reminding you to always be sexy, always be classy, and always stay a little badassy. See you next time. Thank you for listening to the Libido Lounge. Please don't keep me a secret. Please share this with your friends. You can find me on YouTube, on Instagram, as well as how to work with me at mylibidodoc.com.